In this video, we will be discussing delegation to the floater nurse, or floater nurse assignments. We will go over 5 different questions. I will read the question for those listening, pause to give you a second to think, then read the 4 options, and then we will discuss what the best answer is. Let's get started. Number 1. A med-surg nurse is floated to labor and delivery or postpartum. The patient that should be assigned to the med-surg nurse is. What have you learned about float nurses? Should you assign number 1, a patient who is pushing, number 2, a 6-hour postpartum patient requiring intervention for renal failure, number 3, a mother-baby who are stable, or number 4, a patient with a gestation of 12 weeks with hyperemesis? The answer here is number 4. You have to look at the question. It says that this is a med-surg nurse. They normally will always tell you who's floating, and they do that for a reason. So we want to be thinking, if this is a med-surg nurse, we have to try to find something that that med-surg nurse is comfortable with, which would be a med-surg-like patient. So if we look at it that way, number 1 is not med-surg. Number 2, that one does have renal failure, but we have to be careful. We can't pick an answer that's part false. A 6-hour postpartum patient would still require lochia and fundus checks, which the med-surg nurse is not competent in. Number 3 is not okay because that med-surg nurse doesn't, again, know how to take care of a postpartum mom or do a newborn baby check. So even though that mother and baby are stable, it's not within the nurse's scope of practice, so you have to be careful. Number 4, the patient is pregnant, but they're only 12 weeks along, so there's not much intervention to do with the baby there. A maternity nurse might come in Q shift and do the Doppler and find the heartbeat, but otherwise the mom's basically in because she's throwing up a lot. And med-surg nurses definitely take care of people that vomit. So that's why number 4 is your answer. So the way to do these floater assignments is to really know what the floater is used to doing. And also to remind yourself that just because a patient is stable, it doesn't necessarily mean that that patient who is stable is in the nurse's scope of practice. Question number 2. A medical nurse is being floated to a surgical unit. Which patient should be assigned to the medical nurse? Number 1. A client 3 days post-amputation that needs blood sugars checked and a bath. Number 2. A client in Buck's traction. Number 3. A client 1 hour post a Whipple procedure that needs frequent vital signs. Or number 4. A client status post a colectomy that needs discharge teaching about post-colectomy care and diet choices. This is a medical nurse, so we want to think of what that nurse is used to taking care of. They're used to taking care of people like diabetics, heart failure, Crohn's. Unfortunately, all the choices here are surgical. So we are going to look into these options and see which one would the medical nurse be more comfortable with. And number 1, the client is 3 days post their procedure, and they need blood sugar checks and a bath. That's the correct answer. The other ones are too acute. Numbers 2 and 3 are too acute. And then number 4, that client needs discharge teaching about a surgery which the medical nurse wouldn't have knowledge of. So that leads us back to number 1. So make sure sometimes numbers can help you out. And just because a discharge seems stable, again, you have to remember, would the floater nurse have the knowledge to teach that client? 3. The charge nurse is making assignments for the next shift. Which patient should be assigned to the fairly new nurse? 6 months experience, pulled from the surgical unit to the medical unit. So this is considered a new grad. A new grad is any nurse with less than a year experience. Would you give that nurse, number 1, a 58-year-old on airborne precautions for tuberculosis, TB, number 2, a 68-year-old just returned from a bronchoscopy and biopsy, number 3, a 72-year-old who needs teaching about the use of incentive spirometry, or number 4, a 69-year-old with COPD who is ventilator dependent? So the answer here is number 3. If we look back at the question, this is a new grad, but the nurse is coming from the surgical unit. So I still want to try to find somebody surgical that might not be too complicated. And so at this point, how many times do you think that new nurse has taught somebody about incentive spirometry? I feel like that's just a standard for surgical nurses to be teaching their patients prior to going into surgery, to make sure that they know how to use the incentive spirometry and deep breathe when they get out. So number 3 is the answer. Number 1, that's medical. Number 2, it is surgical, but it's more acute. I don't want to give that to a 6-month experienced nurse. And then number 4, definitely not on the ventilator. She's surgical. Again, she's not medical or CC, critical care. So we're going to stay away from that one too. Make sure that you're always paying attention. Is it surgical? Yes, but also new grad. So in this case, we had 2 things to think about at the same time, surgical plus more stable. Question number 4. A medical nurse is floating to a cardiac care unit. Which patient should the floater nurse be assigned? And if you're listening to this video, you're going to have to look at the screen for a sec. What just popped up are 4 different cardiac strips. And I can't tell you what they are, or else I would give away the answer. The answer is number 3. The floater is a medical nurse with no telemetry experience. So in this case, we're going to give the nurse a patient they might see on a medical floor. And yes, in this case, stable does work conveniently because we don't want to give a patient with any kind of dysrhythmia. So if you need to remember, take a memory picture of number 3, that is normal sinus rhythm. You didn't need to waste time here going through and analyzing what all the other ones are. You just needed to spot normal to know that that medical nurse takes care of usually normal sinus rhythm people. That nurse is not a cardiac care nurse. So for those of you that are just curious, number 1 is AFib, number 2 is SVT, supraventricular tachycardia, and number 4 is a 3rd degree heart block. Not that you need to know that to get this answer right. Next question. Question number 5. A maternity nurse is floated to the emergency room. Which patient would be most appropriate to assign to the maternity nurse floater? Is it number 1? A client 1 week post amputation that states his pain is worse at his surgical site. Number 2, a client 3 days postpartum with an infected episiotomy. Number 3, a client who was in a car accident complaining of shortness of breath from the airbag hitting her sternum. Number 4, a client with stomach cramps and complaining of a headache. So hopefully at this point, you are really just looking for something maternity, looking for something that floater is used to doing. That was the thought. It's a floater nurse from maternity, and that infected episiotomy is definitely something a maternity nurse would know how to take care of. So your answer there is number 2. So final learning, always think about what the floater is used to doing and make those assignments. This next slide will give you a floater hint. Feel free to take a screenshot. Final slide that wraps up this floater nurse hint. First, always look and consider who the floater is and what their scope of practice is. Know what the floater is comfortable and competent in doing. Second, if there's no patient in the list of options that fall under that nurse's scope of practice, then try to find the most stable patient, still considering what that nurse might be comfortable doing. And finally, if you do have a new grad floating and they don't mention the specialty, then that is definitely the time that you can go for the most stable patient, since new grads don't have any experience yet. Hope you enjoyed critically thinking through these floater nurse questions. If you want more content and questions like this, please subscribe to our channel. Don't forget to like our videos, and you can always find us at signstrategies.com.